Theradex M is a multivitamin product that is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are important for the body and help maintain good health by providing essential building blocks. When it comes to taking Theradex M, you should take it by mouth, usually once a day or as directed by your doctor. It's important to follow all the directions on the product package or as directed by your doctor, and not to take more than the recommended dosage. Taking this medication regularly will help you get the most benefit from it, so try to take it at the same time each day to help you remember. If you have any questions, don't hesitate to ask your doctor or pharmacist. If you experience constipation, diarrhea, or an upset stomach while taking Theradex M, don't worry, these effects are usually temporary and may go away as your body gets used to the medication. However, if these symptoms persist or worsen, be sure to contact your doctor or pharmacist right away. It's important to remember that if your doctor has prescribed Theradex M for you, they have determined that the benefits outweigh the potential risks of side effects. In fact, many people who use this medication do not experience any serious side effects. Although it is rare, a very serious allergic reaction to Theradex M can occur. Seek medical help immediately if you notice any signs of a serious allergic reaction, such as a rash, swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so if you notice any other unusual effects, be sure to reach out to your doctor or pharmacist for guidance. If you are in the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can contact your doctor for medical advice, or report any side effects to Health Canada. If your multivitamin contains iron, it's crucial to keep it away from children as accidental overdose can be fatal. If overdose occurs, seek medical help immediately or call a poison control center. Theradex M is a medication that contains iron and is used to treat or prevent low blood levels of iron. It is best to take Theradex M on an empty stomach, at least 1 hour before or 2 hours after a meal. The recommended daily dosage is determined by your doctor based on your medical condition and response to treatment. Are you allergic to any of the ingredients in Theradex M? Make sure to talk to your doctor or pharmacist before taking it. It's also important to let them know about any allergies you have, as well as your medical history, especially if you have a history of alcohol abuse, liver problems, or stomach/intestinal issues. If the multivitamin brand you're considering also contains folic acid, be sure to tell your doctor if you have a vitamin B12 deficiency before taking it. Folic acid can affect certain lab tests for vitamin B12 deficiency without actually treating the anemia. Untreated vitamin B12 deficiency can lead to serious nerve problems, so it's important to consult your doctor or pharmacist for more details. If you're planning to have surgery, make sure to inform your doctor or dentist about all the products you're using, including prescription drugs, non-prescription drugs, and herbal products. If you're pregnant or breastfeeding, it's crucial to talk to your doctor before using Theradex M. This medication can pass into breast milk, so consulting your doctor before breastfeeding is essential. Drug interactions can have a big impact on how your medications work and can even increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's also crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. If your multivitamin contains iron, you should avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or some antibiotics. It's best to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin contains folic acid, make sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. It's also important to note that this medication may interfere with certain lab tests, which could potentially cause false results. It's crucial for lab personnel and all your doctors to know that you are taking this drug. If someone has taken too much Theradex M and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. You can call 911 in the US, or contact your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. If you suspect an overdose, don't hesitate to seek help. Make sure to attend all your medical and lab appointments as scheduled. In addition to Theradex M, some brands may include ingredients like docusate. If you're unsure about the ingredients in your brand, be sure to ask your doctor or pharmacist. It's important to note that Theradex M is not a replacement for a healthy diet. It's always best to get your vitamins from nutritious foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your doctor. And remember, always consult your doctor before starting or making changes to your medication routine. If you are taking Theradex M on a prescribed schedule and happen to miss a dose, take it as soon as you remember. However, if it's close to the time of your next dose, it's best to skip the missed dose and just take your next dose at the regular time. It's important not to take a double dose to make up for the missed one. Just stick to your regular dosing schedule for the best results. It's important to store Theradex M at room temperature, away from light and moisture. Make sure to keep it in a safe place that is out of reach of children and pets. Also, do not flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. It's best to consult with your pharmacist or local waste disposal company for the correct way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.